Welcome to Healing Together. I'm Deirdre Tomlinson. Today, I'm talking to Dr. Kat Toups, a functional medicine psychiatrist who treats diseases such as dementia, schizophrenia, and depression from a functional perspective. We'll learn more about what that means in a few minutes from Kat herself. Our conversation includes Kat's personal experience of early onset dementia symptoms, her healing journey, and a primer on inflammation and chronic inflammation, the good, the bad, and the ugly. We discuss how environmental toxins and food choices can contribute to chronic inflammation, and the latest research on COVID-19. Without further delay, please enjoy my conversation with Dr. Kat Toups. So to begin, maybe let's time travel back a little bit to your story of your autoimmune disease. And I know that it began with really facing some symptoms of what we would typically think of as age-related symptoms. But for you, they showed up at a time when we would not expect those symptoms.
Well, let's put those age-related symptoms, give it a bit of a name, the big D word, because really I was manifesting dementia at the time that I turned 50 years old. And at that time, I was running a clinical trials research center, doing many different clinical trials with different types of psychiatric and neurologic medications. And I had done 20 long-term Alzheimer trials, and I was in the midst of several. And I started to realize that I was having as much problem with my memory as some of the patients in my trials were. I would give them 3 words to remember when I was testing their mini mental status exam, and I couldn't remember the 3 words when I would ask them to remember it a couple of minutes later. So I had 2 sets of words that I alternated with, and I had used those 6 words for 20 years. They were something I knew like the back of my hand, and I couldn't remember them. So I was having to write them down to get the answers from my patients. And that's when it really got clear to me. I knew I had been struggling, but I just kept trying to maintain and keep going. And that was a big eye-opening problem for me. It was the start of my journey, learning functional medicine, how to unravel this and how to get out of the conundrum that I found myself in. You mentioned autoimmune disease, and I definitely had I'd struggled on and off probably ever since medical school with autoimmune problems, but it had never gotten to this point before. I was covered with rashes and hives. I had become allergic to everything in my environment, and that's now called multiple chemical sensitivity. I don't even think we really had that term back then. This was 10 years ago. And so I was having just rampant inflammation from being allergic to everything. So that was one of the factors that was just, when you have inflammation in your body, it also travels to your brain. And there were multiple other factors happening, not only the autoimmune phenomenon. And I always, when I work with dementia now, it's just like it's a perfect storm of so many variables that come together. It's never just one thing. I should say almost never. You could certainly have something that's just one thing, but really it's all the factors happening with our biochemistry and our hormones and our toxins and our infections that all come together. But for me, it definitely came together and resulted in a pretty clear-cut case of dementia once I realized what was going on there.
And can I ask how old you were when this was happening? Yeah,
I was 50.
Okay, wow.
50 years old. And I, at that point, had treated hundreds, thousands of people with dementia. And we were seeing some younger people in their 50s with dementia. And I knew that it seemed to be qualitatively different. People that had dementia in their 50s, it went faster. So typically when people manifest a later onset Alzheimer's kind of picture, we say, okay, once it happens, it's going to be a 10-year decline toward death. People that have it when they're younger, it seemed to go much more quickly. And I would diverge and say now, in these last 10 years, I am seeing and diagnosing and treating more and more people in their 50s with dementia. And that's a really frightening thing. We know that the dementia statistics are climbing through the roof right now. And some people say, well, we're diagnosing it better. But, the reality is that our world is becoming more and more toxic, and people are succumbing to these types of disorders at earlier and earlier ages. So it's actually not that unusual anymore for me to have people walk in the door in their 50s having major cognitive problems.
Wow. So you mentioned rampant inflammation that you were experiencing that at the time when you were having these symptoms. For people who are non-medical, what is inflammation in its simplest terms? I think we've been hearing that term a lot. It's been sort of a hot topic in the past few years, but especially recently in the context of COVID.
Right.
We've been hearing about inflammatory response. What is inflammation? Is it good? Is it bad? Maybe both?
Yeah, it's both, of course. Inflammation in the short term is a good thing, and it's a mechanism that helps us to heal from an insult or an injury or an infection. Say you got cut with a stick and early man, came down out of the trees, walking on the ground, gets a wound, and you need your immune system to come and heal that wound and, prevent the infection, or if you have an infection to put that infection, to put the fire out of the infection. So inflammation is a cascade and a series of things that basically brings in healing elements to fix a problem. Say you get an infection and you have a fever. Well, the infection has created some inflammation, and the fever is part of the inflammatory cascade to help kill those microorganisms that caused your infection. So inflammation in the short term is a necessary and a good thing for us to have. The chronic inflammation is where we get into trouble. So when we have chronic problems, then the inflammation in the short term is still destructive. It's designed to kill things. Say in the case of an infection, you got an infection, and then your body releases all of these inflammatory cytokines, which are chemicals to kill the invading microorganisms. And if it's running rampant and going on over long periods of time, then it starts destroying blood vessels, brain tissue if it's, killing something in your brain, joints if it's something in your joints. So it's the chronic inflammation that causes problems for us. And that takes me actually back to the toxins in the world. I mean, we know there's lots of chemical toxins that have accrued with all of our industrial development. It's said that newborn babies have more than 200 chemicals already in their bodies. And that comes from what's stored in the mother's body, and the babies are connected by the cord blood to their mother. So we're seeing, infants already with high levels of toxicity. And these are being born to presumably women in their 20s and 30s. So you take those of us in your 50s, 60s, 70s, you've had even more time to accumulate all kinds of toxins and chemicals. Well, when we have those chemicals and heavy metals in our body, our immune system is designed to react to those things. It's trying to clean it up. But if you have these invaders in your body, be they chemicals or infections, the immune system is going to keep trying to churn out inflammatory cytokines to fix the problem.
Got it. So inflammation really represents two sides of the same coin. It serves a vital purpose, but it can be detrimental if it's chronic. And you have also been on both sides of the story here. You were a physician. Well, you still are, but you were a physician, and then a patient yourself, and back again after you healed. What did you learn from those transitions between patient and physician?
Well, that would probably be longer than the scope of this interview. I learned about a conference called Food as Medicine, and I managed to make it to this conference, and it really opened my eyes to, first off, the notion of food as medicine, how what we eat really is shaping our health or our sickness. And like many people, I thought I was eating healthy. I ate organic food. I ate free-range meat, and I thought I was eating healthy. I think I had long given up the Diet Dr. Peppers that I drank growing up and things like that. But it was really an eye-opener to see, even when you think that you're eating healthy, that there's a lot of nutritional deficiencies that are happening because of the farming practices and that our soil's been over-farmed. They showed us maps of different parts of the country and that there were different nutritional deficiencies in different parts of the country, like this one doesn't have these minerals and this one doesn't have these vitamins. So in that conference, they kept talking about functional medicine and the Institute for Functional Medicine. And I was wondering what that was. So I sat back and I Googled it, and their next training module was on immune and allergy. And I thought, oh my goodness, well, here I am allergic to everything. I better go to that. So that was the start of my functional medicine journey. And functional medicine, I think a lot of people don't know what functional medicine is. So let me say a little bit about that. Functional medicine is about finding the root cause of why you're sick. It's not just giving you a diagnosis. So I could say, okay, I had immune disorder, I had chemical sensitivity, but that doesn't mean anything, does it? It doesn't tell us what to do to fix it. It doesn't tell us why did it come, how did it evolve. In functional medicine, the question really is, why do you have this? What are all the factors that led to the development of this situation? And how do we fix those things? So instead of just saying you have, diabetes and we're going to give you some medicine to bring down your blood sugar, in functional medicine, it would say, well, what's dysregulated in your diet, your exercise, your sleep, all of the factors that could drive up your blood sugar. And then you fix those things, and then you don't have a long-term disease and you don't have to manage it with medication. Functional medicine was just an eye-opener for me. I call it the real medicine. I think it's why most of us, we go to medical school in the first place. We want to help people get well. And unfortunately, we haven't always been given the tools to deal with the chronic illnesses that we're seeing in our society right now. Functional medicine gives us a way to look at all these multiple factors and help restore the organism or the person back into a balance, because our bodies are designed to heal. I mean, we got by for centuries and centuries with, no modern medicine. And it's true, people didn't live so long. And, we lost lots of people to infections before we had antibiotics. And, they've been a great boon to medicine. But really, our bodies, they're amazing healing mechanisms, but we have to get out of their way. We have to remove all of the bad things that we're doing for them. And then the body can start to heal. I'm not sure I got back to the beginning of that question.
No, that's great. I'm imagining that some listeners may be going, wow, okay, I guess I really need to take a closer look at what I'm eating. But others might be feeling, what if I already eat organic foods and grass-fed beef? Mm-hmm. Kind of like, what the heck? What else should I be doing? So I'm wondering if you can share a few more specifics about what the next steps might be beyond just eating well.
Yeah, well, and I think people that are eating that way, hallelujah, that's where you start. For general health and for any kind of chronic disease, you have to first start with your diet and what are you eating. So people that are already eating that way are very far ahead of the game. Many of us grew up with processed foods. I was around in the 60s when Hamburger Helper came on the scene. It was the first things that came in a box that, could make your mealtime easier. And so I think the processed food, the stuff's out of boxes and packages, that's just dead food. But if you're already eating well and you're having problems with something, then you do have to look deeper. The health of the gut is also really where I start with helping somebody with any kind of problem. So the gut is the root of our immune system. And if we're eating things that are triggering our gut, or if we have too much stress alone causes what we call leaky gut. I think that's a term that's gotten pretty commonly known and understood these days, but it's exactly what it sounds like. There's microscopic holes in the lining of the gut. And this happens from food allergies or bad foods that you're eating, or it happens just from stress. they've shown that college students during exam time all develop leaky gut. And so when the gut is leaky, there's these microscopic holes. And one of the biggest culprits that we know for leaky gut is gluten, the protein that's in the grains of the bread and the flours that we eat. And it doesn't matter whether you're allergic to gluten or not. You'll have a much worse response if you're actually allergic to it. But even if you're not allergic to it, it destroys the lining of your gut. There's a protein that holds the cells in the lining of your gut together called zonulin. And the zonulin, when it's elevated, destroys the junctions between your cells. So when you eat gluten, it elevates the zonulin. It causes these microscopic holes between your cells. And then whatever you've eaten then can travel through those cells across the lining of your gut and get absorbed in your bloodstream. And your blood is supposed to be sterile. So if you're leaking little microscopic food particles into your gut through your leaky gut, that is going to turn on your immune system and that whole inflammatory cascade that we were talking about. So the health of the gut is primary with any kind of chronic disease, any kind of health problem. To me, that's where I always start. I look at all the GI symptoms people have. I look at the diet. I look at anything that they might be eating that could be triggering that. Sometimes we look specifically at food allergies. But I think that personally, I just think that gluten is a destroyer for people. So I actually ask all my patients to avoid gluten. There's so many good and easy options to replace that these days. It's not as difficult and devastating as it was for me 10 years ago when there weren't well-known good options to remove it.
Really interesting. I mean, that explanation of the importance and the impact of leaky gut syndrome in the context of the fact that blood should really be sterile, that helps drive home the importance of addressing inflammation. Maybe going back to inflammation for a minute, how do you measure or quantify or diagnose inflammation, say, aside from the presence of symptoms or the presence of a disease? What tests might you order for a new patient that you're seeing and why? What would those tests tell you?
Right. Well, I do a lot of testing for different things, but for inflammation specifically, there are a couple of just common and inexpensive blood tests that can be done at Quest or LabCorp or traditional labs. And one is called the CRP, the C-reactive protein. And we actually these days often order the HSCRP, which is a high sensitivity CRP. It's just a better measurement. But that CRP is a marker of systemic inflammation. And there's another marker that was around long before the CRP, and that's just the SED rate or the sedimentation rate, or it's sometimes called ESR or erythrocyte sedimentation rate. So both of those are useful markers. Sometimes they're not elevated because that's measuring in the peripheral blood. Sometimes people are having neuroinflammation in their brain, and they may or may not have an elevated CRP level. But it's certainly a good, easy, inexpensive test to look at. And then when people are elevated, it gives us a marker that we can follow and make sure that we're getting that down by all of our interventions down into a normal level.
You mentioned inflammation that could be present in the brain, but not showing up in any kind of markers in the blood. Maybe talking a little bit more about the brain at this point. What is functional medicine psychiatry? We've touched on functional medicine here, but how do underlying causes of inflammation impact or influence psychiatric diseases?
Yeah, good question. Not a short answer, but so I'm a psychiatrist by training. I'm boarded in psychiatry and neurology, and I used to be boarded in geriatric psychiatry. And so, I'm worked over 30 years now with all kinds of psychiatric illnesses and brain-based illnesses. In my training, of course, for things like depression and bipolar and schizophrenia and OCD, you make a diagnosis and you prescribe a medicine. And I told you I ran a clinical trials research center. I've done over 100 clinical trials with all kinds of new medicines in the pipeline. And I was always so hopeful. Okay, this is a new mechanism of action for an antidepressant, and this is going to help my suffering patients. And, these medications, I'm not anti-medication. I mean, medications are Band-Aids. And when you're bleeding, you need a Band-Aid. So if they relieve some symptoms, that's a great place to start while you're trying to figure out what is really driving that disorder. But now, to me, it's not what is the name, but again, why? What's happening? What's causing this disorder? And so applying functional medicine to psychiatric disorders is looking for all of those root causes. And, we talk about antecedents and mediators and triggers. And when I take a history from people and they fill out my forms, I ask what happened to their mother when she was pregnant. Okay, what happened, in the early years of your life? And we go through all the stages, and I look at things that happened with illnesses. Do they have a lot of ear infections? Do they have colic? And also huge stresses. Did they lose a parent when they were young? Were they victims of crimes? I mean, it's all of the stressors also are a factor of the health of the immune system. Just to say, with the trauma and the stress, we know very clearly now that people who have had adverse childhood experiences with major stress 10, 20, 30 years down the road have a much higher risk of autoimmune diseases. So trauma, emotional trauma, is one more factor that we have to understand for the immune system as we try to understand what's happening with these disorders. So back to functional psychiatry. It's amazing that so much of psychiatry now, for me, looking at what are the things out of balance that can be fixed here to make the brain work better, to make the neurotransmitters work better. I mentioned starting with the food and the health of the gut. I've had patients I had a patient come to me with a severe major depression. She was crying all day long. She was suicidal. She just was not functioning. And so I said, okay, we're going to do a workup, but in the meantime, I need you to change your diet. I want to stop gluten and I want to stop dairy, because dairy is the second most inflammatory thing we eat. And gluten is our most common food allergy, and dairy is our second most common food allergy. So I said, I'd like you to stop gluten and dairy. I'd like you to eat this whole foods diet. And I'd like to put you on some basic nutrients. Kind of my basic nutrients that I think everybody needs are a good fish oil, some vitamin D. For the vitamin D is like a hormone. It's very important for your immune system. And we're seeing that now with the COVID illness, that people that are vitamin D deficient have a much higher morbidity and mortality rate with the COVID infections. So vitamin D is just critical for our brain. And we know with vitamin D, if you're deficient in vitamin D, if your level is less than 30, you have like a 75% higher risk of getting Alzheimer's. And if it's less than 20, it's through the roof, your risk of getting Alzheimer's, which shows us like that vitamin is critical for our brain, but it's critical for our immune system. So fish oil, vitamin D, and a good B complex vitamin, because B complex, the B12, the folate, all of the B vitamins are essential for the workings of our brain. And many people are deficient in those as well. So I probably just put her on those key basic nutrients, changed her diet. She was one of my early functional medicine patients, and looked into doing some more workup, some stool testing, some other lab testing. And she came back like 6 weeks later, and she was good. She was fine. And that was rather a shocker, right? Here's a woman crying all day, suicidal. And it didn't take that much for her to come back into a balance. Then, time passed, and 5-6 months. And in January, she, called and said, I need an appointment. I'm really depressed again. I'm crying again. So I said, okay, come on in. And we reviewed what was happening. And she said, well, it was the holidays, so I cheated on my diet. And I was eating a bunch of gluten and sugar. And that put her right back in the toilet again, right? So, it's just so powerful when you start to see this over and over. First off, like what the food can do for the brain and the emotional components. I had one patient with schizophrenia who was a vegetarian, and you definitely can eat well as a vegetarian, but there's some caveats that, you definitely have to supplement with B12, you have to supplement with CoQ10, and you have to eat vegetables. So this vegetarian didn't like vegetables. And I always ask my patients before they come in, they have to fill out a 3-day food diary. And I think anybody should do this. Write down everything you eat and drink for 3 days and look at it, because sometimes we think we're doing better than we are. And seeing it in black and white can be telling. Well, this gentleman only ate rice and naan. And, he's eating bread and rice. That's it. White foods, no colors, no nutrients. And he was completely unwilling and really unable. I think if he was able, he would have been able to understand and change his diet, but he was, psychotic, delusional, and that's all he wanted to eat. And so it doesn't take a doctor or a scientist to know that that diet is not going to keep you healthy, right? You have to be feeding your machine here, the right nutrients for everything to run properly. So obviously always start with the diet and the health of the gut, what's happening with the gut. And we do comprehensive stool testing, and we look for, do you have enough of your probiotics? Do you have overgrowth of yeast? Do you have parasites? Are you making digestive enzymes? If you don't have enough digestive enzymes, you can't break down your food to absorb those nutrients. And with aging, people gradually lose the levels of their digestive enzymes. So that's a factor that you need to know about. Are you having inflammation in your gut? Is your gut immune system turned on? In which case, you're either eating foods that you're allergic to, or you actually have infections in your gut that are turning on your immune system. So there's a lot of information that I can get from a test like that to help the brain function. And then looking at all the levels of the nutrients, what's your B12 level? I mean, it's long been known that low B12 levels causes dementia. And that's low-hanging fruit. It's very easy to measure a B12 level and make sure you take enough. Same with your vitamin D, measure the level. Regular doctor can get these tests from a regular lab, but you just don't know until you measure the level. And with vitamin D, I live in the San Francisco Bay Area, and we're too far north to make enough vitamin D. People say, oh, well, I'm out in the sun a lot. I don't need to take vitamin D. And that's just not sufficient. So it's important to know that early man evolved at the equator. And the equator is going to have the most intense sun, the most hours of sunlight. It's very different than those of us that live in the northern hemisphere or further south in the southern hemisphere. So the farther we get from the equator, the less amount of sun we're going to have. And we need that sun to go through our skin and trigger reactions to make our vitamin D. Even people that are working outdoors every day, they will still be vitamin D deficient. So it's just so important to check the level, check your kids' levels. I mean, if we can rectify these things for our children before they ever get sick, that's what we need, right? We need prevention. It's one thing having to chase your tail once you're sick, but let's prevent it. So with functional psychiatry, the other thing that I look at a lot is infections. The food is a factor, but a lot of infections like to live in the brain tissue. Syphilis is an interesting example. We don't see much syphilis anymore these days, thank goodness. But in the old days, a man would have an STD, a sexually transmitted disease, and then maybe he'd get over it. And then 10 or 20 years later, he'd go crazy and was mad or demented. And that's because the syphilis moved into his brain and then over time ate up the brain. So an organism that we are seeing a lot of right now that is in the same class of microorganisms as syphilis is Lyme disease. And Lyme disease is a spirochete, and syphilis is a spirochete. And guess where Lyme likes to live? It likes to live in the brain. It also lives in the joints. Some people have Lyme and they have a joint. Their knees are swollen. It's in the joints. And maybe not in their brain, but other people have no joint symptoms, but they start developing psychiatric symptoms, cognitive symptoms, and that's one of the things that needs to be looked at. And unfortunately, the state of the testing with Lyme disease is not excellent. There's a lot of different strains of Lyme, and the traditional tests like Quest and LabCorp are doing very limited testing, and they very often come back negative. But if you dig into other testing modalities, people that are testing more strains and more varieties, then you will find it. but it's way too often missed. And I can tell you that right now I am doing a clinical trial with dementia using a functional medicine approach for dementia. And I have 10 patients in my site. It's being done at 3 different centers, but I have 10 patients. And of those 10 patients, 4 of them had active Lyme disease. And not just like antibodies from the past, but the antibodies showing current infection. And that's not their only issue. Dementia, just like with psychiatric, just like with other medical issues, it's multiple factors. But obviously that's one issue. And if we're trying to save the brain and we don't address that, when you have an infection in the brain, back to that whole inflammation, infection is going to trigger an inflammatory response. Your immune system gets activated to kill the infection. And Lyme is called a stealth infection. It's actually the Lyme colonies will secrete this gelatinous biofilm around them so that the immune system can't get through and kill them. They're called stealth organisms because they're sneaky. It's a very sophisticated microorganism. So people can have chronic Lyme that will eat up their brain. We see herpes. The cold sores is herpes simplex 1. And it's long been known. They looked at studies of people that died with dementia and they autopsied their brain and they found that 99% of them had high levels of herpes simplex 1 in their brain.
And do you know, maybe the science isn't there yet to say, but is it known whether it's the infections themselves that are causing disease in the brain, or is it the chronic inflammation?
That's a good question, and it's probably both. When we have infections, many of them are drawing on our nutrients and usurping our vital essence to feed their reproduction. So they can directly hurt the organism, and the immune response coming in to whack them over the head is also going to destroy tissues along the way with it.
Got it. Well, that definitely makes sense. Maybe we can circle back to your journey at this point.
Yeah.
Having discussed the immune response and chronic inflammation and some of the effects it can have.
Right.
Can you share your healing process with us? What did you do or try?
Yeah.
And how did you eventually heal?
So it was I was unable to work for 3 years when I stopped working, and I moved all my research trials to another center. And I thought, I'm going to take a month off and I'm going to be well. I never even had a month off, which was probably one of the factors of why my immune system wasn't so happy, right? I was a workaholic, and that's still something I struggle with. But I worked through all of the layers that I needed to work through. I was learning them with a sieve for a brain. Literally, I could not dial a phone number without getting confused. I couldn't decode sounds. I couldn't understand what was being said to me. I couldn't back up or parallel park a car. I mean, my brain was degenerating really rapidly. So I was struggling to learn things, how I could fix it while it was so dysfunctional. And one thing that I think is important in so many levels is, of course, I created a community to help me learn those things. So I took all of the other Bay Area physicians that were studying functional medicine and created a study group. And that was a wonderful way for us all to support each other in our learning in this process. And we know now, and everybody's struggling with this with the COVID lockdowns, right? It's detrimental to our health not to have community with people. So there's a lot of wonderful things that come from that are very important for our well-being. But I worked through all the layers of the science, and one of the things that I kind of came to after I was back to work, I was listening to a webinar. It was a whole one of these podcast series, and it was about mitochondrial dysfunction. And mitochondria are in all of the cells of our body except our red blood cells, and they're called the powerhouses of our cells. They generate energy. Mitochondria make the energy that fuel everything in our body. And so many, many things whack our mitochondria and make them not function, like these infections, the toxins, the heavy metals, the lack of proper nutrients. All of those things kill mitochondria. And we know that mitochondria start declining with age, and when they decline too much, we die. So mitochondrial health is super important. And that, podcast, okay, I'd already learned, all the things that they said in there, except one thing that I hadn't really learned. And it struck me that it would have been super helpful for me And I actually went on to learn and do it. And I thought this could help for some of my patients as well. And it was about, I'm trying to think how best to say this, rewiring your limbic system. Our limbic system is the structures of our brain that are involved with emotional symptoms. And when we're sick, like in my case, I was fearful. This food, I eat this food, it gives me rashes, it gives me hives, it gives me brain fog, it gives me fatigue. I get scared of eating that. You get scared of eating anything new. When you're really allergic to everything, you restrict your diet more and more and more because everything's making you sick. Well, what happens when things are making you sick is it makes you afraid. But of course, living with fear is a drain on our immune system. I mentioned earlier that stress can cause the leaky gut, and we're trying to heal our gut to heal our immune systems, right? So learning to regulate the emotional components of being sick or whatever stress is in our life, I think is super important. So there was a woman speaking there named Annie Hopper, who had a system, she calls it DNRS, Dynamic Neural Retraining System. And she has a program where she's developed a practice that people do. And it's a combination. I mean, we know that meditation can change your brain. The two best things we know that can change our brain, meditation and exercise. That's well documented, well known. It increases our BDNF, our brain-derived neurotrophic factor, and that helps us make new neuronal connections in our brain. So what Annie Hopper derived from all of her own studies and her own path and her own healing path is a practice that people could do every day. And it incorporated all kinds of different things. It incorporates tapping, which is if people can Google tapping, and like you can do tapping for anxiety, tapping for headache, tapping for depression, tapping for sleep. There's practices where you tap on points on your head and chest while you say certain affirmations. And those kind of things literally will change the patterning in your brain. And so her practice, it had some tapping, it had some visualizations. You took a happy memory and you felt it all and you ran all that energy through your body. There was positive thinking, and it's a little practice that incorporates a lot of different modalities. And people that were stuck in these loops of being sick because of the emotional fear construct can get well. So you can buy her tapes and do this at home, and it's pretty labor intensive. She says you need to do an hour a day for 6 months to rewire your brain. And I knew I wasn't going to be able to find the time to do all these, I believe it's, 14, 16 hours of tapes at home and fit that into my life. So I went to one of her boot camps. You go for 5 or 6 days and you learn the practice. And when I learned it, I go, are you kidding? This is it? Like I paid thousands of dollars and took a week off of work and this is it? I was like kind of underwhelmed, right? But I went along with the program and I did the practice, and actually they had, I registered late and I didn't get to stay at the nice place, and I put in a motel off-site, and the motel that I was in had mold, and we haven't touched on mold, but mold and mycotoxins are another issue that can eat up your brain, and I had become quite sensitive to that. And then my room had been cleaned with all this bleach because of the mold, and I would have to come home every night and leave my doors open before I could even go in there for a while. And so being back in that environment with the mold put me into a very dense brain fog, and I was back to being sick again, so I actually needed that practice. And I saw miracles happen in those 5 days. I saw people come in so sick. And then basically this was a boot camp. We did this like all day. We did it in groups. We did it individually. We did it at night. And if I hadn't seen it with my own eyes of how quickly I saw people shift, that would probably take 2 years of very intensive psychotherapy to do. And it was working on rewiring their own brain and their own emotional responses in their brain. And there's other systems. There's a Gupta system that's similar to that one. And there's a lot of information coming out now about the vagus nerve that controls our emotional responses. But basically, we have to be in a parasympathetic mode to heal. We have two modes in our nervous system, the sympathetic nervous system and the parasympathetic nervous system. And the sympathetic nervous system That's our drive. It gets us going. But if the sympathetic nervous system is in overdrive, we get stuck in what they call fight or flight. And so that happens when you're sick. Everybody that's really sick, that can't get out of the hole, that can't function, they feel like they're the only one that's like this. They feel isolated because they can't make social plans because they always get sick, and they feel fear. But we can't heal when we're in that state. So when we go into the parasympathetic state, that's like a zen, calm, relaxed state, right? And we get those states from meditation. We can feel that way after exercise. We can do Tai Chi, Qigong. There's many ways to get into that state. But it seems like our world these days, we have so much overstimulation, and, we have so many computers and cell phones and video games and things coming at us from all direction that seems to keep many of us in that sympathetic overdrive. And so I guess for me, this is a long, long answer as I'm thinking through it while you asked me the question, but I think learning the importance of taking my nervous system down into that parasympathetic mode so that healing can take place. And that's got to be a continuous thing. It's like we all need to find whatever modalities work for us to do that. And then we need to set aside time on a daily basis to train our nervous system that it can go, right? We need that. So I think that's another huge barrier to healing. And I think that's probably, besides all the facts of how to fix this and fix that and nutrients and infections, but it's that, for me, that was the biggest aha moment.
That's wonderful. And I so appreciate you saying that getting to that parasympathetic state is something we can incorporate in little moments on a daily basis. I think a lot of people may be trying to improve their health, but don't have time for a retreat or a getaway.
Right.
And it's just a helpful reminder that healing is actually something we can do in short windows of time each day.
Well, and it doesn't, okay, for the DNRS program that I mentioned that, they recommend an hour a day. Okay, that's for people that are really sick. And, some of the Qigong masters that I've studied with also say, if you're really sick, you need to practice 2 or 3 hours a day. That's what it takes when you're really sick. But for the rest of us, when we're not really sick, but we're stressed and we need to, deal with our health, mental health and physical health, we know that just 12 minutes a day of a meditative practice will change your brain. 12 minutes. And guess what? You don't even have to do 12 minutes at once. You can do 4 minutes 3 times a day. It's like obviously, if you can do a practice for 20 or 30 minutes or longer every day, great. That's wonderful, and that's a gold standard. But there's life, and not everybody can manage to do that. They have kids, they have work. But it's like if you can just find those little moments of peacefulness and mindfulness. If you go on a walk, turn off the cell phone, smell the smells of the flowers and the fresh air, and listen to the birds, and just get out of your head and come into your body. Okay, that's a little meditation, right? You don't have to sit in a lotus position and chant some mantra. And that works great for people as well. It's just like finding what works for you. You can wash the dishes. And for me, like when I wash dishes and the water's going on my hands and I have I look out the window there and, I just try to make that a little mindfulness break. Turn off my head and look out the window and feel the water on my hands. So for me, part of my job is finding what works for different people, what kind of modalities work for different people. And, there's a lot of them, but just simple mindfulness. Something beautiful that one of my patients told me is that she and her husband, they go on a walk every evening and they call it the gratitude walk. And they just they talk about what they're grateful for that day. And you can do that when you go to bed. Prayer is a meditation. You can go to bed and just say, I'm grateful for this comfortable bed that I'm laying in. I'm grateful that I have this roof over my head and it's not raining and I'm not sleeping on a cold ground and, I have food in my stomach. And you might have a lot of problems, but there's always things to be grateful about. And what happens with something like that is it literally is a hormonal change. It releases oxytocin, which is our feel-good hormone. Oxytocin is a natural opiate. And when we love people, oxytocin is called the love hormone or the bonding hormone. When we have a baby and we hold the baby and we love it. And The oxytocin actually for a woman that's breastfeeding makes the breast milk come out to feed her baby. But, when we love our partners, our friends, our dog, that induces hormonal changes in your brain. And so when you take little moments just to remind yourself of what you're grateful for, that's a wonderful healing modality.
I'm curious what you've been learning lately on a personal basis. We're in this time of COVID, and it doesn't have to be something specifically about that.
No.
But just in general, what do you feel like you've been learning about in your life right now?
Well, I'm always learning. I'm definitely a lifelong learner, and I literally learn and study every day of my life. So it's some of the personal and the occupational, they're all intertwined because that's why I'm here, to help people. And it means I have to learn things to help them. So I definitely went down the rabbit hole for months of learning absolutely everything that I could about COVID and working on a COVID task force and co-authoring a paper looking at some of the treatment modalities. And like many people, I hit the wall and said, you know what? Okay, I have to back off from eating, drinking, sleeping COVID all day long. Though I still, still on my horizon. And I want to tell you actually something that I just learned today that I think people will be interested in about COVID. It's related to the blood types. And they found out that people that have blood type A, the ABO blood types, if you have a blood type A, you have a 50% higher risk of having trouble with ventilation with COVID and maybe needing to go on a respirator. 50% higher risk. And if you have blood type O, you have a 50% lower risk. So, we're learning that something with COVID obviously is affecting our oxygenation, and the red blood cells and these different blood cell types are related to carrying oxygen in our blood. So, I'm still learning things about COVID, and that's what I learned today that I definitely thought was fascinating. So there is obviously a genetic component to who gets sick and why. And the more we can learn these things, the more prevention we can do, because there's things you can do to protect your lungs and improve your oxygenation, including daily good exercise, which is a huge part of healing we haven't talked much about. On a personal level, I have to force myself to set aside time for self-care. I am a workaholic. I am a type A, like just go, go, go kind of person. And I literally yesterday spent some time writing my ideal daily schedule so that I could schedule in that time for self-care and relaxation kind of thing. So I'm working on that, It's a work in progress, and I hopefully have 30 more years. So I need to keep trying to put those things in on the schedule. And if I don't schedule that and I say, okay, I'm going to exercise later, and then something else came and filled that time, and then it's too late, things go by the wayside. So I am working on my own self-care.
Good. Well, we're all a work in progress, right? I guess it's just nice to know that we're not the only ones.
Yeah. Uh-huh.
Can I ask you a few rapid fire questions here at the end of our conversation?
Okay, sure.
What are your top stressors today?
My top stressors. This is just a personal thing. I have trouble with my focus, and I did not have that before I had all the brain damage that I sustained. So trying to not be distracted, and how do I leave that cell phone off from all the things that are coming into me constantly, because I'm working on books and teaching and things that I need to do because I have so much I need to impart to people right now that I've learned. So it's working on my focus. Biggest stressor, the focus for me.
And what are your top resources for feeling good?
For feeling good, I think exercise is huge. Exercise is cheap. Like, it doesn't cost you anything. You don't have to go to a fancy gym. And for helping us on all levels, our physical health, our strength, our balance, our oxygenation to our brain, making new brain connections with elevating the BDNF, that's my number one thing. And I think that we're all sitting here trapped at our computers. And I know I used to, when I ran my research business, I was going from room to room all day long. I rarely sat down. And now I sit at my computer for hours and hours and hours a day. So we need to move. I think that's really my number one thing. Well, was there more to that question than that?
No, that's great.
And, the move is the flow. I mean, our lymphatic system is our detoxification system. And in order for the lymph to move, we need to move. That helps the flow. So when we're sitting all day, everything gets stagnant energetically in our body and the lymph just pools and it's not moving around. So I have a little rebounder and, I'll have the best of intentions, to get up every hour and jump on my rebounder for 5 minutes. That rebounder is an amazing thing. They recommend it for people with cancer that really need to step up their lymphatic drainage and clearance. But when you jump on that, you just feel like you don't have to jump. You just walk in place. It's easy on the joints. If you're older, you can get a bar and hold on to it if you need that. But you just feel like you're vibrating all in your body. But you don't have to have a rebounder. You can just stand in place and jiggle. Just start jiggling your whole body, moving it all around and jiggle, 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 and do that.
Yeah, I'm doing it right now.
Yeah, I was doing it while I was telling you. And you just start you feel the flow in your body. So yeah, that's what I think people can do. Jiggle.
I love it. So great. Okay, what are you reading right now?
What am I reading? I always have stacks of books that I'm reading. What I was reading last night is I went to a writer's workshop with the Hay House last year and befriended a lovely woman, and we went out to dinner and hit it off and have stayed in contact. And she just published her book, and it was about her evolution of becoming an intuitive and a channel. She taught 7th and 8th grade for 20-something years, but now she has a practice where she helps people with energy medicine and intuition medicine. And so it's a story of her evolution and also the messages she gets from her spirit guides and the wisdom that they have. So that's what I was reading last night.
Another book question for you here. I guess it doesn't have to be a book. It could be an article, but I'm thinking of a book. Uh-huh. If I wanted to give someone something to read that would introduce the concepts of functional medicine, what would you recommend?
Yeah. One of my favorite classics, and it's an older book, but Mark Hyman has written many, many books about functional medicine with different topics. And he's a wonderful teacher. He has a gift of just making things simple and clear. So I would say any books by Mark Hyman, MD, that strike your fancy would be good. But the one that spoke to me early on is called The Ultra Mind Solution. And that one is one where he really talks about psychiatric cases of autism, and how working through the layers allows us to reverse mental and psychiatric illnesses, including autism. So that one is near and dear to my heart since I work in those areas. But I would say any of his books are excellent. And, he has different ones about food, fats, diet, this, that. Amy Myers, MD, was her first book. What's it called? The Autoimmune Solution. Prevent and reverse the full spectrum of inflammatory symptoms. So Amy trained at the Institute for Functional Medicine the same time I did. And she, I think, really put a lot of the layers together nicely in that book. So maybe those are two good ideas to start with.
Great. Well, we can share both of those books in the podcast notes so people can find them.
Okay.
Last question for you is, how can people find you?
I have a really, I think it's a nice Facebook site, my work Facebook site, where I try to post a lot of information about functional medicine and the brain and dementia and psychiatric issues. And I really try to keep it positive. I try to stay away from all the doom and gloom and conspiracy. I like to post interesting ideas and research there. So it would just be my name, Kat Toups, MD, Functional Medicine Psychiatry and Dementia. I have a very nice and engaged group there. I haven't really been blogging on my website. So, and I think I finally posted one thing on Twitter with a story that was written about one of my patients reversing his dementia and getting his driver's license back. But so mostly, I try to keep it simple and keep things on my Facebook site.
Great. Well, we can share the link to your Facebook page, and maybe we can link to that article as well.
Yes, we haven't really talked that much about dementia, but it's become a deep focus for me, learning all of the ways that we can reverse dementia and That's such an important message that I'm trying to get out to people in the world to understand that dementia is not a death sentence. And the traditional neurologist is going to tell you, get your affairs in order and get ready. But please do not buy into that, because we have all kinds of ways that we can turn things around. And with my dementia clinical trial, I will be finished at my site, I think the end of October. And some of my patients have already completed, but I can tell you that all 10 out of 10 patients of mine are making steady gains and improving rather than declining. So dementia is not a death sentence. That is a message that I want to get out.
Well, that is a wonderful message to end on. Thank you so much for speaking with me today, Kat. This has been a really wonderful combination of scientific and medical information, as well as helpful and hopeful suggestions. So thank you very much.
Wonderful. Thank you so much for having me. I'm really happy to be able to talk to you and everybody that's listening.
Healing Together is produced by Healthenly. Our theme song is Ramble, composed and performed by Ed Morneau.